tail, 4 feet, 12 toes. Mr. Rhino, look what grows. 2 big horns on the tip of your nose. Now you got 3 friends, Mr. Rhinoceros, elephant, buffalo, and hippopotamus. You got 2 bad eyes, but you're not deaf. In Africa and Asia, there's not many of you left. Mr. Rhino, everybody knows you got 1 tail, 4 feet, 12 toes. Mr. Rhino, look what grows. 2 big horns on the tip of your nose.
Speaking of nose, Rhino the rhinoceros was getting his yearly checkup after moving from Africa to the farms of Pennsylvania, where he is surrounded by hay, grass, and pollen. The nurse begins her assessment by reviewing his health history. Rhino states that he has chronic rhinitis and that it has been more of a problem ever since moving to Pennsylvania. The nurse begins her assessment and can tell that Rhino's rhinitis has worsened due to the sensitivity when palpating his nasal cavity.
Definition and symptoms of disease. Chronic inflammation of the inner linings of the nose along with postnasal drip. More specifically, it's present through 1 or more of the following symptoms: rhinorrhea, runny nose, nasal itching, nasal congestion, and sneezing. The causes are unknown, but environmental irritants are triggered, such as chlorine, cigarette smoke, perfume, and latex, as well as some medications. The treatment includes nasal irrigation for chronic rhinitis, which is a personal hygiene practice with which the nasal cavity is washed to flush out excess mucus and debris from the nose and sinuses. You can also take over-the-counter or prescription medications. It's important to avoid secondhand smoke or direct smoking, as these are known to cause additional irritants. Additional information. A significant correlation exists between chronic rhinitis, asthma, and chronic sinusitis. Allergic rhinitis caused by environmental allergies is the most common cause for chronic rhinitis. There are also connections between chronic rhinitis and eustachian tube problems. This is where the tube connecting the inner ear to the back of the throat is located. When assessing a patient without chronic rhinitis, their nasal passages and lining of the nose would be clear without any inflammation, postnasal drip, nasal itching, or nasal congestion.
After the checkup, the nurse educates Rhino to continue his nasal irrigation as well as taking his prescribed medications to avoid any further irritation. Although Rhino's condition can never be fully cured, he will be able to control and regulate his symptoms.